Did you know that over 50% of falls in elderly people result in a significant injury? Do you know how to do a home assessment to help prevent your mother or father from falling? By the end of this video, you will have the tools you need to decrease the risk of your parents having a fall. By subscribing to my channel and hitting that little bell, you will be notified every Monday when I post a new video designed to help you navigate the sometimes confusing healthcare system. As a pharmacist and as the daughter of elderly parents, I have helped many adult children as they took over the role of caregiver to an elderly parent. Falls can occur anywhere, but did you know that they most often happen in the home? And while some falls only result in embarrassment or a skinned knee, other falls result in a serious injury that may lead to a permanent lifestyle change or even death. Every 19 minutes, an elderly person dies from injuries sustained from a fall. 1 out of every 4 adults over the age of 65 fall every year. Nearly 1 million people are hospitalized each year because of fall-related injuries. And these injuries usually involve either a head injury or a broken hip. Falls can be caused by many things. Elderly people may have decreased eyesight, causing them to overlook obstacles. As we age, we are usually weaker and develop balance problems, so a stumble for a younger person can become a dangerous fall for an older person. Medications may cause dizziness or drowsiness, increasing the risk of a fall. What is your biggest fear you face as your parents are getting older? Leave your comment below. While not all falls can be prevented, there are steps that you can take to make sure that your parents are safe at home. First, remove all clutter that may be a tripping hazard. Get rid of throw rugs. You cannot make them safe enough and they are not worth the risk. Remove them. Make sure there is plenty of room to walk around the furniture. This may mean removing some of the furniture if the area is too tight. Put grab bars, correctly installed, next to toilets and inside shower stalls. Make sure all areas, especially hallways and stairs, are well lit. Putting a nightlight in the bathroom to help show the way may prevent accidents at night. Make sure that the path from the bed to the bathroom is free of anything that might catch a toe of your father who isn't quite awake in the middle of the night. Make sure outdoor walkways are smooth and don't have any cracks or broken areas that may trip your mother. During the winter, hire someone to come remove the snow and ice from sidewalks if you can't do it yourself. Install rails on both sides of the stairs. Make sure that your parent has proper footwear with non-slip soles that are not too thick and not high heels. Make sure your father has the appropriate prescription in his glasses so he can see better and reduce the risk of falling. Have you noticed that your mother is limping or shuffling when she walks? This needs to be evaluated by her physician to find the cause of the change. A cane or walker may be needed if your mother is unsteady on her feet. Is your father diabetic? If his blood sugar is dropping suddenly, this can cause dizziness. Frequent blood sugar drops may indicate that his medication dose needs to be decreased. Have your pharmacist evaluate your parents' medications to check for any medications that might be causing dizziness. Blood pressure medications, antidepressants, seizure medications, pain medications such as hydrocodone or oxycodone, muscle relaxants, nitroglycerin, sleeping pills, and antihistamines are only a few of the classes of medications that may cause dizziness. And over-the-counter sleep meds are often overlooked. Any medication that has PM in the name has the potential to cause dizziness. Melatonin, while a safer choice, may still cause dizziness if your parent gets up in the middle of the night. While often these medications cannot be discontinued safely, your parents can be instructed to stand up slowly, count to 10 before they take a step to decrease the risk of a fall. The pharmacist can work with your parent's physician to adjust medications so that the desired effect is achieved while minimizing the risk. Also, always check with your pharmacist before starting your mother on a new over-the-counter medication. Many over-the-counter products, especially cough and cold products, can increase the risk of falling. Your pharmacist can double-check your father's medication list to see if there would be any medication interactions with the OTC product that might cause increased dizziness. It is important to have a pharmacist you trust to talk to about keeping your parents safe. Ask your mother's physician if she needs a vitamin D supplement. Recent studies have shown that people with low vitamin D levels have an increased risk of falling. Vitamin D is also important for keeping bones and muscles strong, so adding this inexpensive supplement may be beneficial in more than one way. Moving slowly and deliberately can help prevent many accidents. Other factors that may increase the risk of a fall include having fallen in the past, needing to push with both hands to stand from a chair, loss of feeling in the feet due to diabetic nerve damage or other nerve damage, and worrying about falling, which actually increases your risk of falling. While it is impossible to prevent all falls, there are steps you can take to help reduce the risks. First, ask your physician for a safe exercise plan for your father. Gait training and balance training from a physical therapist may be helpful. Strength training, flexibility exercises, and movement exercises such as dance, yoga, or Tai Chi are also something to ask about. Walking is especially good, but always clear any exercise program with their physician to keep them safe. By being aware of risk and removing all hazards, you can decrease the possibility that your father will have a life-changing tumble in his own home. But if your 71-year-old mother tells you about how she climbed a tree to cut out the broken limbs with a chainsaw, I don't know what to tell you, except good luck. Raising parents is difficult, and I have other videos that address issues that need to be discussed. You can find them here. I have written an ebook that helps parents and children address subjects that may be difficult to bring up, but are necessary to plan for the future. You will find the link to get this free resource in the description below. I'm sure it will help start the conversations that are oh so important. If you found this video helpful in keeping your parents safer in their own home, please give it a thumbs up and share it with your friends. Are you taking care of an aging parent, or are you the parent that's aging? Have you done a home assessment to make sure it is safe? Type "assessment done" in the comments below if you've made your parents' home as safe as possible, or if you are planning to do so soon. Thank you for joining me today to learn how you can keep your mother and father as safe as possible in their own home. Have a blessed week.